Allow me to explain the total laryngectomy to you. The neck tweeter is a term used to describe people who have undergone this operation. So, what is total laryngectomy? Total laryngectomy is the removal of the whole larynx, which includes the three major cartilages, namely the thyroid, cricoid, and arytenoid cartilage, as well as the epiglottis and some of the minor cartilages. Then, there will be a permanent open hole in the neck called stoma, as you may see in the lower right portion. This stoma is connected to our lungs. Therefore, breathing happens through the stoma instead of the nose. Since the larynx is connected to our nose, mouth, and lungs, it will affect an individual's way of speaking, swallowing, breathing, and it will cause decrease of smell. The removal of the larynx is essential to the following condition. First is the cancer of the larynx. Second, severe injury or trauma to the neck. And third, radiation necrosis, which is the death of a healthy tissue caused by radiation therapy. This is done to prevent further complication. Moving on, there are different methods to communicate. First is the tracheostophygial voice. A one-way valve will be inserted through the tracheostophygeal puncture and the prosthesis will be attached with it. With this, the person will be able to speak by covering the stoma occasionally. Then, the electrolyrics. It is a device that will be placed upon the neck, which produces robotic sound. It is easy to learn and use. Third is the esophageal voice. It is a method wherein a person will trap the air that is inhaled through the mouth, in the throat and upper esophagus. Then, it will make vibrations if the air is released in regulated manner. Unlike the electrolarynx, it is hard to learn but it's also effective. And of course, we can also communicate through nonverbal communication such as writing, reading, body language, and such. Since stoma is an open hole, it is prone to infection. So, it is important to know on how to take care of your stomach. And here are the following steps to take care of your stomach. Gently wash the skin around the opening of the stomach with mild soap and water, then wipe it dry. Remove the excess mucus and crusting with caution, or you may cough out the mucus. Keeping stomach clean and free from secretions will prevent it from becoming dry and irritated. You may still do normal activities such as bathing or exercising. Just remember to prevent excess soap and water from entering your stomach. Use a stomach cover when going outdoors to keep the bacteria from entering the stomach and cause an infection. And also, use a cap to avoid your stomach from sun exposure. And you should also cover your stomach whenever you sneeze or cough. During nighttime, you may use humidifier to moisten the air that you breathe, and it prevents your stomach from crusting. It also alleviates breathing and also helps to reduce coughing. This is me, Ferdinand Shane Gutang of UPHSL Medical University. Remember to keep your larynx healthy for you to breathe, eat, and speak normally. Salamat, ingat, and God bless.